Hypertension Awareness Series Episode 18. After diagnosis of hypertension, when do you start treatment? This is a very important episode in all our series. When you decide to start a patient on medication for hypertension, and this is a critical decision point that many get wrong. After diagnosing hypertension, evaluating for organ damage, and assessing the cardiovascular risk factors, the next question is, do we start treatment now or wait? Remember, we do not treat numbers. We assess the whole cardiovascular risk. So, number one, start with the overall cardiovascular risk assessment. The treatment decision will depend on the whole patient. What is their age? Do they have diabetes? Do they have chronic kidney disease? Are there any established cardiovascular disease? Is there any hypertension-mediated organ damage? The overall cardiovascular risk. Higher cardiovascular risk, earlier treatment, even at lower BP levels. For example, a 52-year-old male with diabetes and protein in urine and a BP of 135/85, start treatment immediately due to the high cardiovascular risk. Use validated risk tools to guide your decision making, and these tools are available online. Some examples are WHO Afro-E risk calculator. You have the SCORE2 OP for the ESC, and also the Prevent AHA ASCVD risk calculators. This will guide assess the overall cardiovascular risk. Number two, for stage 2 hypertension, BP over 160/100, start treatment immediately. So start medication without delay and combine with lifestyle changes. Most of these will require 2 or more drugs from the start. For example, a male with a BP of 168/102, immediate treatment plus lifestyle. For stage 1 hypertension, BP of more than 140/90 but less than 160/100, 2 pathways. If there are low risk, low cardiovascular risk with no hypertension-mediated organ damage, start with lifestyle. Lose the weight, stop smoking, healthy diet, cut down the salt, assess after 3 months. If the BP is still over 140/90, start medication. Lifestyle continues. For example, you have a 45-year-old male, the BP is 145/92, no diabetes, no organ damage. Start at lifestyle modification and review for 3 to 6 months. At that time, if the BP is still high, then you can start on medication plus lifestyle. For stage 1 at high risk is high cardiovascular risk plus hypertension mediated organ damage. Do not wait. Start medication even at stage 1 with lifestyle. This applies to hypertension with hypertension mediated organ damage, which we discussed, diabetes, chronic kidney disease, established cardiovascular disease, and high overall risk. For example, you have a patient with BP of 145/95 and on ECG they have left ventricular hypertrophy. Start medication immediately. Remember the overall risk, hypertension mediated organ damage overrides the BP level. So for the 55-year-old with a BP of 148/94 and has LVH or proteinuria, start lifestyle and medication from the word go. The clinical take-home message is that the BP level plus the overall cardiovascular risk and the hypertension mediated organ damage guides the decision. For stage 2, BP more than 160/100, start treatment from the word go plus lifestyle. For stage 1, BP more than 140/90 and less than 160/100, assess. Low risk, no HMOD, lifestyle, monitor in 3 to 6 months. If still high, start treatment. If you are in stage 1 with high cardiovascular risk or hypertension mediated organ damage, start treatment. Starting treatment at the right time can change the patient's life and start treatment at the right time. Early, timely decision protects the organ, and with the right treatment plan, consistency, lifestyle modification, hypertension treatment can be done, BP can be controlled, and organ damage protected. Early, timely treatment prevents irreversible damage. Do not delay. Remember, for this question on when to start treatment, it is the BP level and the overall cardiovascular risk. Stage 2 hypertension, BP more than 160/100, start treatment from the word go plus lifestyle. For stage 1, assess, are they low risk? If they are low risk with no hypertension mediated organ damage, you can do lifestyle alone, then monitor for 3 to 6 months. If the BP is still high, even if at that point we're in stage 1, start medication as you continue with lifestyle modification. If you're in stage 1 plus hypertension mediated organ damage, treatment starts from the word go. BP of 145/95 plus LVH, start treatment. BP of 145/95 plus protein in urine, start treatment. BP of 145/95 plus diabetes, start treatment. The key point on when to start is not to be BP centric, not the BP figure alone, but the BP level plus the overall cardiovascular risk. I hope now it is clear on when to start treatment and medication in your patient. Stay tuned for our next episode where I discuss what medications do you start with. Once you decide your patient needs treatment, what are your choice of the antihypertensives? Dr. Beatrice Muthui-Mutua, saving lives one heart at a time, all the way in Mombasa for the Kenya Association of Physicians and your conference.